What is PCOS or Polycystic Ovary Syndrome? Our hypothalamus secretes gonadotropin releasing hormone or GnRH, which travel down to the anterior pituitary, and the anterior pituitary will secrete LH, that is luteinizing hormone, and FSH, that is follicle stimulating hormone. These two hormones travel through the blood to the ovary, then act upon the theca and granulosa cells of the ovary, causing them to produce estrogen before the ovulation and progesterone after the ovulation. In polycystic ovarian syndrome, the follicles don't ovulate. In patients who does not have PCOS, after the ovulation, the graphene follicle will be converted to corpus luteum. This corpus luteum will secrete progesterone. This progesterone has a negative feedback on the gonadotropin releasing hormone, thus decreasing the GnRH, that is gonadotropin releasing hormone production, which in turn reduces the LH, luteinizing hormone, and follicle stimulating hormone production from the anterior pituitary. In patients with PCOS, there is no ovulation, so there is no production of corpus luteum, and hence there is no production of progesterone. Since there is no progesterone, there is no one to inhibit the production of gonadotropin releasing hormone. That means there is no negative feedback to the gonadotropin releasing hormone to stop production. In PCOS patients, due to the lack of the high progesterone from the corpus luteum, there is no negative feedback for the gonadotropin releasing hormone. The gonadotropin releasing hormone increases, and hence there is increased production of gonadotropin releasing hormone, and which in turn increases the production of luteinizing hormone and follicle stimulating hormone. In short, the follicular stimulating hormone will be less as compared to the luteinizing hormone secretion, because LH is more responsive to the faster gonadotropin releasing hormone release. In patients who don't have PCOS, FSH is the hormone which makes a follicle mature to a point that it can ovulate. In PCOS, the low FSH won't make the follicle mature enough to ovulate. Each follicle that won't ovulate are the cysts that are seen on the PCOS or PCOD patients. The multiple cysts that are usually found on the USGs indicate the past failed ovulatory phases. And also the excessive LH stimulate the theca cells of the ovaries directly and secrete excessive amounts of androgen. Androgen being a male hormone causing hyperandrogenism, and this hyperandrogenism causing hirsutism, acne, and menstrual irregularities. Patients may also present with infertility due to the lack of ovulation. These androgen may also have a negative feedback on the hypothalamus or the pituitary, making hormone imbalances even more complicated. The androgen also cause reduced insulin sensitivity, and hence the pancreas will secrete more insulin to compensate. This is also called as insulin resistance. This added insulin to the bloodstream, due to the reduced sensitivity, this insulin directly attacks the theca cells of the ovary, which in turn produces more androgen. This is like a cycle.